This week in the lecture, we discussed about how such artificial intelligence algorithms can help with health informatics, specifically with predictive analytics. For example, we learned that social media can reflect the opinion of people and thus may provide useful personal information that can help the doctors or related medical staffs to learn more about the patients. Messages and tweets are important, but we have too many of them to analyze. So the analysis can never be done by human beings, but instead the computer. Bag of words is a good model in that we deal with the contents of tweets or messages in a way ignoring the order of words. We reform the datasets of tweets and then use AI algorithms to analyze this huge dataset. Though sometimes processing is time-consuming, the efficiency is still much greater than processing by human beings.
Major innovations and improvements of electronic medical record systems, otherwise known as EMS, have led to much more accurate diagnosis and effective treatment plans of illnesses. Big data provides a promising opportunity to improve the quality, safety, and efficiency of healthcare. It can be used for predictive analytics applications by using machine learning and artificial intelligence. The pros of predictive analytics, otherwise known as PA, is that it can help clinicians make important decisions in the clinic or at the bedside. PA can help decide the route of healthcare between two patients by informing us which one of the patients will benefit most from ICU care and which one will benefit most from post-operative complications. While there are many benefits that pertain to PA, there are also ethical dilemmas that could interfere with the evolution of this algorithm. Physicians who abide by ethical standards and obligations will ensure that this emerging technology does not interfere with the high-quality individual patient-based care. There's also a conflict of interest in the development of PA for patient care. There are certain conflicts that PA can disclose which may not be transparent in a PA model. Based off of the results of the PA, physicians may feel compromised when helping a patient decide on treatment because the algorithm is designed to improve overall health care of a population and to reduce healthcare costs. Overall, PA models have a wide variety of data, but are not yet close to eliminating all uncertainty in clinical cares.
Hey guys, my name's Ivy, and to introduce the heroin article, we learned that heroin-led deaths have been on the spike in the U.S. According to the article, it has more than quintupled from 2000 to 2014. This epidemic comes from both prescribed and non-prescribed use of heroin. To stop or try to resolve this, we would need substantial data and records of it. However, this is what held back prevention of heroin-led hospital admissions. We also learned that internet search data, such as Google Trends, and locating and tracking key terms being searched for can help with recording and using the research to prevent and predict future heroin statistics. I think by using models that are, as the article stated, low cost and efficient to help aid and guide research to predict heroin for following years is really where information and help collide. Google offers many programs and Trends is one of them. By utilizing what the information world has and repurposing it to aid health research is really interesting to me, and I think it's the epitome of health informatics.
10 metropolitan statistical areas in the United States were used. A list was then comprised of common descriptors for non-prescription and prescription opioids from the Drug Enforcement Agency. The clinical and street names for each opioid were then punched into a Google database to seek out which Google Trends to find out which opioids were also being searched for the most. Now this part is what's important to look at as researchers, because researchers could start to use informatics about relevant drug searches to determine which opioid outbreaks could occur, even before they even happen. If many individuals in a city start to search up where can I buy heroin, and this starts to become a trending Google search in that city, chances are that cocaine is being searched for by many in that city. This information could also be super valuable to us as a population because opioid outbreaks like what was described in the article could be discovered before they even occur. Now this information also could be a downside because if people started to know that they were being monitored in what they search for, they would either not research for it at all, or they'll limit what they're being searched for. Researchers would also need to gain consent from each person before they research, which would be a huge struggle.
The article continues by showing how the study of Google Trends related to heroin admissions is an example of how internet search data can bring foresight on possible public health related events. Not only is it cost effective because it's free and public, it can also help areas where there is no heroin-related data yet by becoming a first step to this process. I believe this is an opportunity to bring more attention to areas affected by such health problems without causing financial loss. The only problem I think would be for countries or areas in which the internet isn't available for everyone. And generally speaking, this is most likely in impoverished areas where the open drug problems are the highest, which brings up the difficulty in predicting such health events for people who don't have accurate internet data to represent them. This also does bring up the problem of privacy, in which people aren't comfortable with others looking into their internet data and footprints, even if it is to help them. However, I do believe that this overall will have a benefit into helping other people in order to predict these events, as long as it's in the right hands. So remember to like, comment, and subscribe.